All right, so I'm Caitlin Murphy. I did my PowerPoint on psoriasis, and this is just a couple pictures to show the effects that it has on the skin. So, very dry, red, inflamed, and cracked. What is psoriasis? Psoriasis is a skin disease that causes red, itchy, scaly patches that are mostly found on knees, elbows, trunk, and scalp. Psoriasis is very common and is a chronic disease that unfortunately has no cure. So this is a picture that shows normal skin compared to dry skin, and as you can see, it's very scaly, dry, and cracked, and as you can imagine, very uncomfortable. This is a woman that has it around the top of her head, and it's very red and scaly and flaking off. Psoriasis symptoms. So some of the symptoms are rashes, red patches, inflamed skin, itchy skin that can lead to cracking, problems with fingers, toenails, including discoloration and pitting, and then swollen joints leading to arthritis. So because there is so much inflammation on the joints, and you can see that in this picture on the elbows, that would most likely lead this person to a lot of discomfort on the joints and can be very painful at times and lead to the arthritis. Types of psoriasis. So there are different types that can happen to you. So there is guttate psoriasis, so that small round red spots caused by inflammation appears on arms and legs and the abdomen. And then there is pustular psoriasis, which is pus-filled, painful bumps that can be accompanied by inflamed or red skin. And this one covers most parts of the body. And then there's plaque psoriasis. This is the most common type. Raised patches of inflamed skin, itchiness, painful scaly skin, appears to some as silvery white scales. So back to that picture of the normal to psoriasis skin, you could see the white scaly parts. It appears on the scalp, knees, elbows, and sometimes around the belly button. And then there is inverse psoriasis. This is inflamed and deep red that is smooth and not scaly. So this man here has it on his armpit. And it affects folds of the skin, like the armpits and under the breasts, and also your genital areas. Emothermic, sorry, that's hard to say. This is redness and shedding of the skin. This happens all over the body and can be life-threatening. Severe symptoms may be dehydration, raised heart rate, and temperature of the body. Some statistics for psoriasis. So 123 million people worldwide are affected by psoriasis. The World Health Organization notes in 2016 that the reported prevalence of psoriasis worldwide ranges between 0.09% and 11.43%, making psoriasis a serious global issue. Psoriasis is most likely to appear first between the ages of 15 and 30 years old. Males and females get psoriasis at the same rate. Who can treat psoriasis? So there are a lot of different treatments that come with psoriasis, but for diagnosing, a physician would need to do this. So that would be like a dermatologist or an oncologist. And then an oncologist would come in if they felt like there was a chance that it could be cancer, because with psoriasis, you are more likely to develop cancer. Triggers for psoriasis. So there are a few. Stress is one of the main ones. It can be the main cause of flare-ups for people who suffer from psoriasis. Diet, so what you're eating, alcohol, different injuries. So if you had a cut and because your skin is very temperamental in this situation, getting anything into that cracked or dry parts of your skin would be very detrimental. Some medications, like blood pressure medication, can affect it as well. And then this is just some other ones in this picture here that show, so infection, tobacco, sometimes, like if you know what eczema is, it flares up in different weather conditions, so that's the same with psoriasis. Complications that come with psoriasis, so risk of secondary infection, like I was saying earlier, with there being dry skin and cracked skin, it opens up room for infection. Risk of lymphoma, possible inflammation, inflammatory bowel disease, and psoriatic arthritis, which is very, very common if you have psoriasis because it is a lot of strain on the joints when there is so much inflammation around there. So to get into psoriatic arthritis, affects some that have psoriasis due to inflamed skin or joints leaving dry, red spots, and can cause joint pain and stiffness. It mostly affects fingertips and spine and can range from mild pain to severe, becoming disabling. So, it has been shown to be like almost sometimes more intense than regular arthritis because it's also accompanied by the rashes and dryness and stiffness in your joints. And then this is just a video about psoriatic arthritis, so I'll play this for you.
What is psoriatic arthritis? Psoriatic arthritis causes pain, swelling and stiffness in and around your joints and spine. It can affect adults or children of any age, but often begins when someone is in their 30s. It normally affects people who already have the skin condition psoriasis. This causes patches of red, raised skin with white or silvery scales on top, which can occur anywhere on the body. Sometimes the arthritis symptoms start before psoriasis. Psoriatic arthritis is an autoimmune condition. This means your immune system, which normally protects you from illness and infection, attacks your body's healthy cells. In psoriatic arthritis, this can lead to inflammation inside and around a joint. This can cause pain, stiffness and swelling in the hands or fingers, wrists, elbows, shoulders, hips, knees, ankles, feet or toes. Psoriatic arthritis can also affect your spine, causing pain and stiffness around the neck, back or buttocks. Some people also get pain that spreads beyond their joints into their tendons. This can happen around several joints, but is common in the feet, either at the back of your heel or the bottom of your ankle. It's important to see a doctor and begin treatment as soon as possible to prevent damage to the body. You'll probably see a doctor who specialises in treating conditions like psoriatic arthritis, known as a rheumatologist. Some people find painkillers such as paracetamol help. Alternatively, your doctor may prescribe
So that's just a little snippet of the video that goes into the introduction of psoriatic arthritis. Psoriasis treatments. So there's topical therapy. So there are lotions, ointments, gels, and that are in mild or moderate areas. There's vitamin D analog. This is a synthetic form of vitamin D. It helps slow skin growth and applied to sensitive areas. Because psoriasis, it is like an overproduction of skin growth. This has been shown to be a really good treatment. And then there's salicylic acid. This is good for a good scalp solution for psoriasis. It can be used in shampoos to treat the scaly parts of the skin on the scalp. Then there's systematic medications. This type of treatment would be for someone that does not respond well to other treatments. So it's been suggested to try an oral method. So you would try all of these different medications, so methotrexate, retinoids, and then all the other ones listed there. I'm not going to try and pronounce them because I'm going to butcher them. And then treatments in the aesthetics industry for psoriasis. In the aesthetics industry, there are a lot of treatments that may help with psoriasis. One that has been found to be very beneficial to different clients are various light therapy treatments. So there's UVA light therapy and UVB, and both have been found to be very effective light therapy treatments. And these are both designed to slow down skin growth. And they have also been shown to help it not come back when it flares up. So that's been very beneficial to people who suffer. And then the summary. So psoriasis affects a lot of people day to day, and over the years it has become easier to treat and manage. But it's important that you are aware of the effects that come with psoriasis as a client/patient receiving treatment, as well as a person that will be helping you and advising you with a treatment. So for us going into aesthetics, it's important that we are aware of all these different conditions that come with clients, but then also them knowing the treatments that they can get or questions they can ask us when they're coming for treatments as well. And then these are just resources and then my cited pictures. And that's it. Thank you.